You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, oral surgeon Dr. Duncan. Dr. Duncan, welcome to the program.
Thank you so much, Randy.
Now, before we get into today's topic, dental implants, and I have a lot of questions here, and you brought photos and models, so that'll be good. Tell us about your practice. I mean, who's the typical patient? What do you do as an oral surgeon?
Well, we really don't have a typical patient because we see age ranges from 4 years old to over 100 years old. So
Is that right, 100 years old?
I've treated, I think my oldest patient was 102 years old, had a tooth removed. But so we see a wide array of patients. As an oral surgery office, we do surgical procedures only. We don't do any fillings or such, but we do wisdom teeth removal, normal teeth removal, implants, pathology, trauma, orthodontic surgery, moving jaws for skeletal deformity patients, AOO procedures, which is accelerated osteogenic orthodontics, procedures for people that are going to have braces that will speed up the process so they can finish in 6 months versus 2 years.
So now you're one of the busiest centers for dental implants in San Francisco, the Bay Area.
Yeah, we place hundreds per year.
Is that right? Now,
Yeah.
you've been there at the beginning of implants. We've talked on the telephone.
Yes.
A little bit about your background and training in regard to dental implants. I mean, what's changed? Why is it better now than it was 10, 20 years ago?
So in the early 80s when we were doing implants, we didn't have the osseointegrated implants, which are what we use today. We had.
What does that mean, by the way? Osseointegrated.
It means that the bone bonds directly onto the surface of the implant and ankyloses the implant in the bone.
Okay.
So it's very strong. We had blade implants, which we drill a trough and hammer them into the bone.
Is that right?
And those worked, but they were
How many years
50-50.
ago was this, by the way?
Early 80s.
Okay.
And then subperiosteal implants, which set on top of the ridges. We'd flap the tissue, take impressions, put implants frames right on top of the tissue. And they worked, but they weren't predictable. And when they failed, it was a horrible problem. Where today with the osseointegrated implants, things are much more predictable and they last longer. Great product.
Now, what does that mean when you say you could do the surgery on a computer ahead of time? What does that mean?
Well, in certain cases now, we're using cutting-edge technology through, in my practice, we use a company called Impronto, and cutting-edge technology to plan the implant case. We take a cone beam CT scan of the patient, and that reveals the accurate anatomy of the upper and lower jaw, and also with surgical guides or radiographic guides, when we take the CT scan, we can find out how thick their tissue is, the shape of their teeth, if they do have teeth, and such. So we can accurately plan and bioengineer a case so that we know exactly where that implant's going to go and in the proper vector to load the implant with the occlusal forces versus freehanding like we did before. So in probably half the cases now we're doing the computer planning.
And who is the typical dental implant patient?
Well,
I mean, what are the age ranges of implant patients you see?
You know, the earliest you can place an implant in a female is 16 years of age because if they grow after you place an implant, the jaw grows, it will change position. So the earliest in a female is 16, males probably 18, and then any age on up as long as
What's
they're
your
healthy.
oldest dental implant patient?
92.
Why would a 92-year-old want a dental implant?
Well, this particular patient was a very vibrant 92-year-old male who had upper and lower dentures, but his lower denture was very unstable due to his very flat ridge from wearing dentures for many, many, many years. So he wanted to improve his lifestyle, and eating was a very big important part of his life, and he wanted to improve. So we put 2 implants in his anterior lower jaw, and he was happy as a lark.
So like 2 implants right about here, I mean right at the bottom,
Yes.
And what, snap in,
snap out, and very, very stable.
92-year-olds, I mean, they have enough bone. They can still get dental implants.
Yes. Very, very, very rare that somebody would not have enough bone to put 2 implants in the lower anterior
You know,
jaw.
I told you this, I think, on the telephone. My mother, 75 years old, says, Randy, my medical doctor, 75, my medical doctor said I'm too old for dental implants. Because I told her about dental implants.
Yeah. Well, that's not true.
But do a lot of people think that, by the way?
Sure they do, and it's not a true statement. As long as the patient is healthy, in other words, they can have diabetes as long as they're regulated well, they're in control. So there's very few contraindications to placing
What if a
implants.
denture wearer, okay, they're 80, they've been in dentures since they were 40. Is that still possible candidate?
Sure. And again, it depends, though. You have to do a CT scan to see what kind of bone they have left. Sometimes we have to do some adjunctive procedures to make them a candidate to have implants, little minor bone grafting procedures or such, but normally, yes, anybody can have dental implants.
You're an oral surgeon. Okay, so do you have a bias? Do you think that, okay, the oral surgeon should be the ones doing these implant surgeries? Do you? I mean, do you feel that way?
I think, no, I think you should go to anybody whose experience is good. I mean, the periodontists do them, the oral surgeons do them, general dentists do them, but you just need to find somebody who's done a lot and is experienced.
Okay.
The advantage of the oral surgery is that we've been trained in surgery, that's all we do, and we have experience with general anesthesia, IV sedation. We're trained in that in our residency. We spend a year
That's a good
doing
point. Okay, so
anesthesia.
IV sedation.
Yeah, our general anesthesia, we're trained in that. We do it every day.
So how long have you had your practice there?
Since 1980.
Okay, now as an oral surgeon, do they need a referral? Like the person wearing dentures, a referral to see you? Can they call you direct?
They can call us direct. Probably 25% of our patients are referred by other patients or hear about us somewhere, a friend or somebody that's family member that's been to us, and so you can come directly if you wish.
Now, does it cost more to go to a specialist, to go to an oral surgeon?
No, that's a misconception.
Okay.
Dental implants, a lot of people are doing them. There's a price range, but there's minimal difference between the cost.
Okay, because people email us. They always want referrals on our wellnesshour.com. Yeah. We don't give referrals, by the way, but I always say the same thing. Go to a specialist.
Right.
I mean, have you done thousands of these, by the way?
I've done thousands. And I think it's important when you're searching for somebody to go to that you find somebody that's been experienced, done a ton of these procedures, because you learn a lot on every case.
Kind of a team approach there, too. You work with another oral surgeon?
Yes. Have another a partner, Dr. Eric Scharf, who's a 35-year-old younger man, and myself, the old dog, so we get along well.
Who's better at implants, by the way?
I'm not going to say that.
He's not here, by the way.
I'm not going to say that on the air, but but we're both good, and
right.
we work cases together, so and we plan them together, and we have fun together.
Okay, good. Categories of dental implant patients. What are the different types of patients you see that come in for dental implants?
Well, we see single implant cases in the back, the front. We see multiple implant cases where they're missing multiple teeth that we're placing in the back or the front. Our patient doesn't have any teeth in the back but has their front teeth which are stable and healthy, then we'll place them in the back. And then you have the patients that are going to have failing dentition. They're going to lose all their teeth, so we're going to do implants to support their prosthesis.
So they have a big choice, I guess, implants or dentures.
It's a major decision.
Okay, and then there's the denture wearers.
Yeah, then we have patients that come in that have been wearing dentures for 6 months or 20, 30, 40 years that want to find a way to create more stability so they can chew better, enjoy their life more.
Okay, let's start with the one tooth. Okay, so why a dental implant? Help me understand why a dental implant is better than traditional dentistry, or is it?
Well, I think so. In the past, with a single tooth missing, such as in a case like this, you're going to prep these adjacent teeth, drill them down, put crowns on them, and hook together with a crown in the middle.
And that's how it's normally done. Is that
yes,
right?
that's how it used to be done before implants became popular. The problem with that is when you're drilling down your teeth, you're traumatizing them, so you weaken them. One, they may die and need a root canal. Secondly, you can't see what's going on under the gum line, so they get cavities under them, and they end up failing down the road, usually. Now, with implants, you don't touch the adjacent tooth. You put the implant down into the jawbone, let it heal, you attach a post, and then your regular dentist will put a tooth back on it so that you're good to go.
And how long can that last, by the way?
Well, we're hoping the rest of your life. You shouldn't be guaranteed that, but I can tell you, in my practice, probably 95% of the implants I put in are still there from 1985 on.
Sounds very painful, by the way.
Well,
do they complain about pain?
That's, again, a misnomer. I can honestly say that probably 98% of my patients have minimal pain the first night or day, take an aspirin or an Advil, very rarely a narcotic, and the next day they have no pain.
Like an Advil. Is that right?
Yes. Yeah.
So even for the denture wearer that comes in and gets a full set of teeth, the next day is pretty good for them?
Sure. Patients come in and say, hey doc, you wasted the prescription on me. Can I give it back to you? All the time that happens. So it is.
Do you take it back?
No, we don't take it back.
You should.
But,
I'm kidding. Go ahead.
It's not painless in every procedure post-op, but it's very minimal pain, much less than an extraction. The point is you can be scared, but with the sedation and general anesthesia that we do now, and the procedures are pretty painless post-operatively.
Because the bone doesn't really...
The bone doesn't have nerve endings, and we do minimal flap reflection now, so
not a lot of stitches these days.
Well, it depends on the case, but
Okay.
a lot of the computer cases we can do flapless, so we just go through the tissue now with the computer guides and such, so generally yes, and no edema and minimal pain.
Would you say the future of dentistry is like no more dentures? You know, when we hear these terms, no more dentures,
Well,
do you think everything will be, stabilized by a dental implant in the future?
The state of the art is dental implants, computer planning. Will it be the standard of care? Yes. But will everybody do it? No, because they're afraid, one, cost, many factors. But it is the state. It's here. It's now. It's the standard of care.
Okay, so let's move into the different options for people that are wearing dentures, by the way. And is this a big problem? Are there a lot of people wearing dentures?
San Francisco area, there's probably tens of thousands.
Well, how come they're all not doing it, by the way? If you're saying 2 dental implants, you could give them something to snap in, snap out.
Sure.
What,
yeah, it's a great, easy procedure. I think they don't know about it. They don't go to the dentist because they have dentures. They don't need maintenance, and they're unaware of what's available. So patients are afraid of experiencing pain from their old dental days when they went to the dentist in the olden days to get drilled on, it hurt. They had root canals that hurt. They had extractions that hurt. Well, that's not the way it is in modern dentistry now. We have new techniques with sedation and such that we can make you very comfortable, and you don't have to worry about the pain. And post-operatively, there is minimal or no pain.
So they're never without teeth. I mean, the denture wear during the process,
right.
They're not without.
They can wear their existing denture. In certain cases, depending on how many implants we put in the bone and how stable they are, we can load them immediately. So they can always wear their current prosthesis.
Okay, so with the 2, and you have a model.
Yes.
What are we looking at here? And this is an actual model?
No, this is just a laboratory model. But
okay.
Basically, we would have 2 implants. These would be in the front of the jaw. And basically what would happen is you need these heal for 6 weeks or so, and then you would attach the abutments onto the implant, and then your general dentist would put the female portion in the denture, and then that would snap on. And that increases the stability. Your denture won't fly up anymore, won't slide on you, and it really helps with chewing your food and such.
Okay, now you say that the longer they wait, the more bone they lose.
Correct.
But that implants, help me understand why implants keep you from losing bone.
Okay, so your teeth sit in the bone. They stimulate the bone.
Okay.
When the teeth are gone, normally in the normal case, the bone will atrophy. You'll get thinner and you'll lose height, especially if you wear partial dentures or dentures because they're pounding on the bone. So you're going to atrophy over time in a normal patient. So your jawbone will get smaller and smaller and smaller, and as that happens, your muscles are going to sink, and you'll age.
You get that
in the
denture
process.
look.
Yes.
Like the nose gets closer to the chin.
Correct. Correct. And the next option is a bar. Now this would require more implants. This particular case has 4 implants, but it's a bar. It's a little more stable.
So 4 implants on the lower. Okay.
It's more stable than the snap-in 2 implant case, but this is what we used to do years ago. I don't like the bar because it's high maintenance for the dentist and the patient. They got to change the clips a lot because they wear a lot, and you're still maintaining the flanges on your denture so it doesn't get rid of the bulk of the denture in your mouth, which can be uncomfortable and create issues.
That's common.
Chewing.
I mean, I've interviewed a lot of guys, and they do the bar a lot. So you don't like the bar because it's just more maintenance?
Correct.
Okay.
And there's better options.
Is that kind of old school then, would you say?
Yeah, I think personally it's old school.
Okay.
I think there's better options at not a much higher price. You can have something better.
So 4 implants, snap in, snap out. What's the next level up?
Okay, so the next level is your fixed. It's going to be a fixed hybrid, which is this prosthesis right here, which can be all plastic, or you can have a gold alloy base, which is stronger, and you have a pink acrylic, like denture acrylic,
Let me take a look at
denture
this.
teeth.
Okay, so this is just like a set of teeth.
Yes.
That go right there.
Just right directly
and
on the
there's
implants.
4 holes.
Yes.
Is that a fixed set also?
This is a fixed set, so it screws in and does not come out. You notice the flange is gone, so the patient can feel better with this out of the hunk of plastic out of their mouth, and they taste better.
Isn't everybody wants though? I mean, they want something that doesn't come in and out of their mouth.
Well, that's, I think, the ideal treatment. Now, the second option on that, the more elegant approach to the fixed patient is the titanium contoured frame, which is made by the computer company that we talked about, Impronto, before. And what this is a milled titanium bar. It's computer generated, very light.
Very light, yeah.
And it's titanium contoured, so it's one piece, it's very strong. The problem with the cast, they're not as accurate because you get...
That's that all-on-4 style.
I mean, anything. This can be all on 4 too, but all that's saying is you got something fixed to 4 implants.
Okay.
Now, the one thing you got to worry about with the all on 4, though, that's going, everybody knows about all on 4, well, teeth in a day is you're getting plastic. So you're not getting a metal base, you're getting a plastic base. The problem is that weakens over time and it cracks and it breaks.
Do you see that, by the way?
Oh, yes.
In your practice?
Oh, yes.
Is that right?
Yes. And even on the hybrids with the plastic teeth, the teeth pop out. So that's an issue. Because when that happens, you got to remove the whole thing and send it to the lab for them and repair it, and it's costly for the patient and the dentist because it takes time. Where the titanium contoured frame is a milled titanium bar that fits exactly the implants, it will not break. It's very strong. And with that, they're individually porcelain crowns placed on here, so it's very aesthetic.
So it's like their own teeth.
It's like your own teeth, beautifully.
And those can last for
should last forever.
And you can eat whatever you want?
Yeah, you can eat whatever you want.
What do patients say? Do you ever hear these patient stories? Bragging to the...
Oh, they love it. I've been doing the titanium contoured frame for 1 year now. We've done about 10 cases. Every patient has fallen in love with this thing because it's beautiful, very pretty. Because we'll show some pictures, but
well, you know, one of the things, and if you're just tuning in, we're talking to oral surgeon Dr. Duncan, and we're talking about dental implants. No more dentures, get a fixed set of teeth in a few appointments. But one of the things that we should mention too, because if people just tuned in, you've been doing dental implants. In fact, you said from day one.
Right.
Okay.
Right.
So you've seen some changes along the way.
Sure.
Where do you stack up as far as technology? Are you using all the new stuff?
Well, I can honestly say with the beauty of getting involved with these companies such as Impronto is that it puts you on the cutting edge of technology with the implants. So yes, we're on the cutting edge.
So you don't like the plastic, so it's like plastic in the mouth?
So we'll offer whatever, we offer the whole range. Whatever we give the patient the option to do whatever they want. We'll tout certain things, but again, I'll do whatever they want. The least expensive way to do it is the 2 in the lower, snap in. It's good, it's stable, but you still have the full
So of the
chunk
thousands
of
of
plastic
denture wearers in San Francisco, okay, you're saying 2 implants. Would everybody agree that's a huge improvement?
Major step up.
If there was a try-in, test drive on one of these for the weekend, nobody could go back to their denture?
They would never go back.
Are you serious?
Yes, never.
It's that much better?
Oh, totally.
You say
Night and day.
Denture wearers feel older.
Well, the reason is they lose bone, so they lose their, we call the vertical dimension normal. That's your vertical dimension. When you lose bone in your denture teeth, they resorb, you close, and your vertical dimension decreases, which ages you. So the problem with making new dentures is trying to open you, they get so thick that they're unstable. So the only way to do that is you need implants to hold whatever that structure underneath so that you can solidify and you can replace the bone and the soft tissue and the teeth. So you can do that with a hybrid, which you're replacing the gums and the teeth, or the titanium contoured frame where you're replacing the gums
That's the one you
and
love.
the teeth. I love the titanium contoured frame. The reason
and
too is,
what's the maintenance on these things?
Minimal. I mean minimal. If you break a tooth on a titanium contoured frame, you treat them like a regular mouth. You cut that crown off, take an impression in the mouth, put a temp on, and make another crown for that area.
Really?
So, and that's going to be unusual if that would happen. Okay, so in the pre-planning of the case, we mock the surgery on the computer software, and the computer will print out a surgical guide for us, and this is what we use to place the implants. Now these,
let me see this. Let me take a look at this.
These are
interesting. Okay. So this is the holes are there for you.
Yes. So we have a special surgical kit that will allow us to insert certain size instruments into the holes that guide our different drills so that we can size the hole slowly so you don't burn the bone. So therefore, we know exactly where this implant's going. We can do it flapless, and this...
Flapless means you don't have to cut the gums.
We don't have to cut the gum. In certain cases, if they have adequate tissue. If not, we got to do a little cutting.
The main thing is find out if you're a candidate. Is that right?
Yes.
If you're watching this, you may be a candidate for this.
Correct.
And very, very interesting. And not everybody's doing that, these guided surgeries.
No.
Why aren't they, in your opinion?
Well, they don't know
your
about
take?
it. Well, it's very complicated with the softwares to plan it and so on. You got to be very computer savvy to do it. So with the new Impronto, makes it so that anybody can be on the cutting edge because we use them, they help us plan it, and so on. So it is cutting edge, and it's a great technology.
Now, general dentists and other dentists will watch this program. What do you want them to know about you if they're watching this right now?
Oh, we're happy to work with any general dentist. We'd love to work with new people, and we'll work hand in hand with you, guide you through the prosthetic portion of the case, and be happy to help you on any of these cases.
Okay, and by the way, so the teeth, when people are coming in for the fixed set, do they look real? They look like dentures? Because I feel like I could spot a denture, 10 yards away.
Yeah, these teeth look very real. Now you can make these teeth look any way you want them to look. You can make them look crooked, you can stain them, or you can make them toilet bowl white, which people have a tendency to do, which I don't like, but patients want that, but it doesn't look real. So you can make them look, the beauty of this is you can make them look any way you want. And you put them at the correct vertical dimension so you look normal with them.
Is there such thing as a happy denture wearer, by the way?
I'm sure there are, sure. I mean,
or they don't know what they're missing?
Well, some people can acclimate to any problem, and I've seen people with flat ridges that can chew anything. So there are certain people that can, but the majority can't.
Okay, so so we talk as a recap, and then I know you brought some photos for the denture wear. 2 implants, snap in, snap out, no more adhesive.
Right.
You could go 4 with that bar for more
Right.
stability.
Right.
You don't necessarily like that. I don't want to put words in your mouth. And then there's what's the next level up? That's 4 implants.
Well, you can do 4. Again, it depends on the quality of the bone, how long the implants are, as to how many implants you need. If we use as little as possible. If we can get by with 4, we use 4, but if you need 6, you need 6. Some patients need 8 because the quality of the bone is not there. So the CT scan, the cone beam CT will tell us the quality of the bone and how many implants, because you do not want to under-engineer the case, because then you're looking at failure down the road.
Okay, and they'll be able to eat anything.
Yes. I can eat anything.
Is that right?
Yes.
Broccoli, I mean, it doesn't matter.
Anything.
I mean, they're strong. Okay, you brought some photos. What are we looking at here?
Well, one, just a sample of showing we talked about the 2 locator abutments on a lower denture, or on an upper denture there's 4. They get rid of the palate if they wish. And then this is a titanium contoured frame. It shows it's pink porcelain. It's not acrylic like that you see in the hybrid.
That's the lower?
So this is a lower hybrid with the pink acrylic and denture teeth. This is pink porcelain baked on and individual cemented porcelain crown. So it's a very aesthetic
interesting
prosthesis. And you can see how it's developed so they can clean underneath
just
it
like
and
water
keep it clean.
pick?
Yeah, water pick, floss tape. It's very easy to keep clean.
What if you have unhealthy gums, by the way? And maybe, I ran into somebody, I was talking to somebody, and they said, the problem is my gums.
Well,
teeth have to go.
Well, once you remove the offending source, which is the teeth, the infection goes away. And
the gums clean up?
Yeah, gums clean up, and and it's very rare that we have issues with periodontal disease on implants. It does happen, but it's pretty rare. It does, but it's pretty unusual. For some reason, plaque doesn't stick to the titanium like it does to teeth, so it's a much more friendly surface or I should say unfriendly to the plaque bacteria.
Okay.
So it's easy to clean, and especially on these titanium contoured frames, they're very smooth. They don't get the calculus buildup we see on other hybrids and such. But still, it has not been a major issue.
Is this the happiest group of patients, you think, in all areas of dentistry? You take somebody wearing a denture and give them a fixed set of teeth? What are your thoughts on that?
I would say yes. I mean, it never fails that when you deliver the final product on one of these frames or the hybrids, they get rid of their denture. They are so aesthetic.
Do they get emotional ever?
Sure. Had cases, yeah. I had a woman, it wasn't a denture, this was a lady who we did upper posterior implant. She had no bone back there. We did bone grafting, we did soft tissue grafting for attached gingiva. She was scared to death. We did her over a 9-month period, and she cried after we finished. She was so happy.
Is that right?
So yeah, it's.
What about the front teeth? You say you can make them and match them up.
Sure. So the front area is called the aesthetic zone, and that is a reason, because when you smile, it shows, and some people, you don't want to look like this, obviously, but the aesthetic zone is the anterior. When you smile, you show your teeth. Some people show all their gums. So we can do things for them. And one thing is, in the anterior, we use white abutment so it blends in with the gum tissue better, the adjacent teeth. And then this is a temporary place. We haven't placed the final crown yet. But you can see that we can get a great result. But the anterior, called the aesthetic zone, is important because you're going to need, you need to really go to somebody that has experience at that, because you need adjunctive procedures along with the implant. You need to thicken the tissue a lot of the times, because when you lose teeth, you lose bone and soft tissue. They both atrophy, so you need to build both those back up.
So it seems like that'd be easy, by the way. So that's trickier.
Well,
more technically demanding in the front.
It's technically demanding. It's tricky. You gotta
go to an oral surgeon.
Well, anybody experienced is fine, but this is another case. So we have a guy who's got a low smile line. He doesn't show a lot of gum, but still it's important to make it look good. And this is his final procedure. I don't know if you can tell which one is the implant, but it is this one right here. So it is important. Even if a lot of patients show a lot of gum, some don't, but still you want it to be perfect.
By the way, people missing one tooth in the front.
You can have a removable partial, a one-tooth partial or flipper that looks good, but it's unstable. You can't eat with it, difficult to keep clean and such. You can do a fixed bridge where you drill the teeth down. You can do a Maryland bridge, where they bond to the adjacent teeth, but the problem is they break. They're not strong, so when you're eating, you never know when it's going to crack or something's going to come off. And again, with the bridge, you're drilling down healthy teeth. You shouldn't do that.
We're out of time. Good stuff. Final message, though. Somebody watching this, they're wearing a loose-fitting denture, okay? What do you tell them?
Okay,
where do they begin?
There are good options for you. Call us, come in, we'll do a consultation, we'll show you your options, go over those with you, tell you what you need to go through to do it, or you talk to your general dentist about implants.
And it's not painful. I mean, it's not something that the patients are complaining about, the procedure.
Correct. It
sounds painful.
It's a great procedure. It's easy, it's simple, we can make you very comfortable.
And the future may be no more dentures.
Correct. I think that's a good
20,
statement.
30 years?
Great statement. Yeah, I think so. I think that's true.
I want to thank you for coming on the show.
Thank
very
you,
interesting.
Randy, very much.
Good stuff. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.